Okay, welcome. So as I'm sure you're aware, today is actually World Suicide Prevention Day 2024. So I want to thank you for joining this webinar, the title of which is Working Together to Change the Narrative on Suicide. My name is Richard Tando. I will be your chair for the next hour that we have together. So essentially my job is to keep the webinar moving and to time. We have quite a lot for you today, so I say I'll make sure that we get through it all and that we reach the end together in just before 1 o'clock. Just a few words about me. I work full-time as an independent technology consultant, but I have lived experience of mental health issues, and as a part of giving back for the help that I got when I needed it, I perform a couple of roles. The first is I'm an expert by experience at Rethink, and Rethink is one of the organizers. Rethink is one of the organizers for this event. But I'm also a peer trainer at the West London NHS Wellbeing and Recovery College. So just to tell you a little bit about the webinar and the organizers. So it's organized by 3 organizations. The first is Grassroots Suicide Prevention. The second, as I've already mentioned, is Rethink, or to give it its full name, Rethink Mental Illness, and also UOK Brighton and Hove, which is a partnership of community service organizations working together. The lead down. And like I said, you will hear from representatives from each of those today. So this webinar is aimed at continuing the conversation about suicide ideation, particularly focusing on at-risk communities. So the communities that often fall through the net of care. So that includes ex-offenders, women, and also people with autism. So to cover off logistics, because often I like to know how the webinar is going to work and whether I need to take lots of notes as I go along and that kind of thing. So we will be sharing the slides and the recording of the webinar afterwards. So feel free to take the notes if you want, but you will get the slides, which do include, recap of resources after the event. There is a chat, which I can see some activity in already, where you can ask questions. We won't be taking questions as we go along, and we won't be answering those in the chat, but we have commitment from the speakers to answer those after the seminar and to share all the questions and answers with everybody that has attended today. So again, please do put your questions in the chat as we go along, but we will come to them after the event. And just to say, look, we know this is an important, but also can be a heavy topic, and one that, is probably does affect people on the call. So if you are feeling affected in a negative way, please feel free to step away. I believe my colleagues are going to put some numbers in the chat for organizations that you can talk to and follow up with, and we'll include those also in the resources. So if we move on to talk about today, like I say, there's urgent need to talk about preventing suicide, particularly, as you may or may not know, in the face of the fact that figures have shown that suicides are at their highest rate since the 1990s. We all appreciate that it's a complex subject. There's no single one explanation as to why somebody takes their life. But we do know from some research that Rethink have done that, in times of economic uncertainty, people wait for help with mental health support. These are issues that do contribute to rising numbers. And actually, we're not just seeing rising numbers with men, but we're also seeing rising numbers with women. So this is another key point. So I'll just round off my introduction by saying that the topic of this seminar is in line with the triennial theme that the World Health Organization has created or set for World Suicide Prevention Day, and that is around changing the narrative on suicide, with a particular call to action for starting the conversation. And I'll just read what they say. They say that this thing aims to raise awareness about the importance of reducing stigma and encouraging open conversation to prevent suicides. Changing the narrative on suicide is about transforming how we perceive this complex issue and shifting from a culture of silence and stigma to openness, understanding, and support. So hopefully that gives us, a good context with which to begin this seminar. So I will move us then to our first speaker. So our first speaker is Lourdes Colclough. She's the head of suicide prevention at Rethink. So Rethink, as I know well because I was a part of it, had been working recently with the Northwest London ICB to deliver a suicide prevention program in Northwest London, but it was delivered as a social response, and it brought some good lessons to the table, which we'll be hearing more about from Lourdes, particularly around the value of community or local organisations in preventing suicide. Their work in partnering with the NHS in order to reach people who don't often get reached by more traditional health services, and then also one that's kind of key to me in realizing the benefit of designing these responses in collaboration with people that have lived experience in mental health issues. So yeah. So we'll hear from Lourdes, then we'll hear from Rachel Swan, who's the CEO of Grassroots Suicide Prevention. We have a couple of interventions from her. Then we'll Gemma, who's going to introduce herself, but also take us through a video, and then we'll move on to Wendy, who's going to talk to us as well, and we'll finally round off with Brooke from UOK Brighton and Hove. But I will introduce each of them as they come up. So I shall stop here and pass to Lourdes.
Thank you, Richard. So I'm going to talk about the Northwest London Suicide Prevention Programme. This was funded by Northwest London ICB and innovative and brave. It looked at a different way of working, putting communities at the forefront and experts by experience. Next, please. I'm putting up this award not to show off, but to maybe show off a little bit, but just because we won this award as a gold winner, as an example of best practice, and really to shape and influence future collaborations in the NHS. So this model worked. I saw the results of this model on a daily, weekly basis, and I just want to show and maybe encourage others to work in a similar way. Next, please. So just a quick overview. Over 3 years, we funded 58 community projects. It was really difficult. This type of work is hard to get off the ground, but when you do, it's absolutely worth it. We gave out £750,000 worth of grants, and we also co-produced some suicide awareness training. That was for, we provided 93 sessions and over 1,000 people were trained. We were initially looking to train a lot more NHS staff, but it was really difficult to get them on board, but the voluntary sector got a hand off for this training. We also worked in a multi-agency way with steering groups and network meetings, and that was a really important part of getting together different agencies, public health, local authority leads, NHS managers and voluntary sector groups to look at sharing resources. We looked at every suicide prevention plan in the 8 boroughs, brought them all together and looked at themes that came out and had a shared action learning set for all of us. Next slide, please. Usually we thank experts by experience at the end. I'm thanking them at the beginning because they were so integral. They were at the beginning of the planning of this programme, middle and end, all the way through. So we had 32 experts by experience altogether. We had a high turnover of them. And here is well in the photo, you can see she was doing some evaluation for us, and with a grant recipient, so women's group that we worked with. And this is the type of evaluation we did. But I've put the outputs just on there because we had 105,419 social connections. So this was a social response to suicide prevention. It wasn't in the clinical arena, it was in the social. So this is what Gemma and Wendy are going to talk about, that psychosocial response, what UOK does, that alliance working, and what Grassroots suicide prevention do. Next slide. There were challenges. It's really time consuming working with experts by experience, high turnover. They're often in transition. There's lots of different things they're doing. There was lots of varied roles we offered. We worked to their talents, their assets, what they could offer. We asked them what they wanted to get involved in. The engagement and the responses were uneven across all the projects. So we had 58 giving from a few £100 to £30,000 in grants. And so the outputs, the outcomes were different, and measuring it was really difficult. And the EBIs were with us on that to co-produce some tools. Also, sometimes grassroots organisations haven't got the infrastructure to evaluate really heavily. So we had to look at that in a different way, and there was some learning for us on that. Proving preventative grants' impact on suicide rates is also really complex and a difficult thing to do, and people do acknowledge that. Next. Our discussion-based panel we had on grants, I thought I'd mention this because it was new and different. We didn't have points-based system. We had loads of people on the panel, experts by experience, voluntary sector, NHS, and there was lots of talking. If the application wasn't good enough first time round, we gave feedback and they could put the application in again. It was very simple, and it stopped the bigger organisations coming in, sweeping in and taking all the money. Next slide. This is just an example of our co-produced work. So we worked with the 2 recovery colleges in the area, experts by experience, and and comedians, and we co-produced a course for men. It was provided at the Comedy Store in Soho, and it was overwhelmed really at the beginning. There was it filled it up very quickly. There was a big waiting list, and we've done some really good evaluation and findings on this. This is what happens when you put experts by experience at the centre. Next, please. Our challenges, I'm going to talk about data because it's really hard to measure this type of work. It's fantastic, but over the 3 years, we tried surveys, questionnaires, focus groups, video diaries were brilliant. So they're a really powerful way to use a phone, get somebody who's been a participant in one of your groups to just tell you what was great about that. And we, at the beginning, we wanted it light touch, but we had some learning from that. And we had surveys that we then started using at the beginning and at the end. We had 32 experts by experience, and we worked with Nurture Development, Cormac Russell, the godfather of asset-based community development, and co-produced some evaluation tools. Next slide. Our key findings were really the ones that were really interesting. Some not so surprising: physical and mental health improvement in confidence. But what was interesting is the grants and the training that left a legacy. So the skills development, the increase in levels of empathy of people. They felt they could emotionally understand each other. There was more vulnerability. They were willing to share and share their experience, within a different setting as well. There was services also adapt. So Body and Soul, for example, started offering prenatal service to women, and we were able to agilely respond to some of the stats that were coming up. And there was the social resources were really important, WhatsApp groups and people meeting regularly. Next slide. Some more findings were new and different ways of coping with people. So they were able to express themselves in a different way. They felt, and a lot of the staff came onto our suicide awareness training too, and leaders of groups. So there were more social connections made, safe and local places where people shared resources, shared their and released their emotions. I mean, it could be a football club, a walking group. We had a black men's group where that one of the leaders went out to work in churches, so they shared about issues they were sharing as well, were finding difficult. And people just felt they could share that in a different setting that wasn't clinical. We did find, so there were organisations we gave larger grants to, like the Listening Place, Body and Soul, Suicide and Co, and they did rigorous evaluation for us, and they places like Body and Soul and Listening Place all showed a reduction in self-harm and a reduction in visits in A&E, and that is monumental, really. And I think that's something we need to build on for the future. Professionals felt they were able to help others with suicidal thoughts, and there was a partnership work between NHS and Grassroots that wasn't seen before. So one of our participants on our comedy course said, for me, it was getting into stuff therapists haven't been able to communicate clearly or as entertainingly. And that was the difference, that was the space. Next, please. So some of our recommendations were that future provision for NHS is given to community groups, that experts by experience are paid and are integral at every level, providing solutions for themselves, and that we give the VCSE and NHS the staff the tools. So what was different about this programme is we had free training and grants on offer, so we weren't going in just data mugging people. And the voluntary sector groups were able to co-produce their own solutions that were culturally appropriate for them. So, for example, the Traveller Movement redid our suicide awareness training for themselves and broadcasted that over their radio station. The multi-agency work was fantastic, and it meant, much like UOK, it means that resources are shared, learning shared, and you can work together in a much more strategic way. I think for future measurement, we would be looking at the impact on acute and emergency settings and future proofing the capacity building for establishing these kind of connections that are made between the voluntary sector, who are already picking up complex situations and people who are dealing with very difficult, trauma and suicidal ideation. So that's it from me, Richard. I hope I've made it between my time. Thank you.
You have, Lord. Thank you very much. Yeah, and I can speak to that program myself. I was privileged to be involved in designing the comedy course for male suicide prevention, and the showcase from the men. I don't have children, but I felt like a proud father at that passing out sort of ceremony. So thanks very much. So then to our second speaker, Rachel Swan. She's the CEO of Grassroots Suicide Prevention. They empower people to help save lives from suicide through education, connection, and campaign nationally. Rachel is going to talk to us particularly today about the Women's Suicide Prevention Hub, which is one of their initiatives, and then she'll go on to take us through three, I think, myths that exist in this area, like I say, as we continue to open up the conversation around suicide. So I'll hand over to Rachel.
Thanks so much, and it's really wonderful to be part of this panel today with our partner organisations that we work with on an ongoing basis. And Lord, it's really fantastic to hear all of that amazing partnership working. It's absolutely vital. And I think also importantly, the lived experience part of what you were saying, as an organisation, we've partnered with Possibility People to create a lived experience network, and that really helps inform all of our work and has helped inform our Women's Suicide Prevention Hub that I'm going to talk about today. So first of all, I suppose to say that when I'm talking about women, I mean anybody that self-identifies as a woman. Next, please, Rosie. We really do support and validate everyone's gender identity. And some of the issues that I'm going to mention today actually are not just exclusive to women. Next. So why am I talking around women and suicide? Well, we've just had the recent data that's come out, and actually we've had a 32% rise 2012 to 22, and it's now the highest level since 1994. And lots of services like our Shout tech service is reporting a higher number. So 48% of people reaching out for support are girls and women under the age of 25, with 37% of those conversations around suicide. We have a Stay Alive mobile app, which is free to download, and it's got nearly 1 million downloads now. And it's available in 14 different languages. And actually, 70% of the people reaching out on that Stay Alive app are women. Next. So why are more women struggling? So we know, look, what do we know already? Suicide is a really complex issue. It affects 1 in 5 of us. It's the leading cause of death in the under 35s. And often when people are reaching out and they're at the point of crisis, they've really struggled with a whole range of struggles and challenges. And it could be anything from being bullied at school, family breakdown, domestic abuse. There could be a mental health issue, but it may not be the only issue. Suicide prevention is much more wider than mental health. But why women in particular? So the research is showing that depression and anxiety is really affecting women more. The research after the pandemic is showing an increase in suicidal thoughts around women. And we know there is additional financial stress, domestic abuse and caregiving responsibilities, and obviously women dealing with sudden death. Thanks, Rosie. Next. And then thinking through my own perspective of being a female in the 45 to 64 bracket, there is a sandwich generation. So women like myself who are juggling caring responsibilities, careers and bringing up children. So when you combine that ongoing societal pressures, the known risk factors, next please Rosie, and also particular risk factors that are unique to women. So we're talking about menopause, domestic violence, the period before having a baby and afterwards, childhood abuse, sexual violence, eating disorders and premenstrual syndromes. When you're looking at all of those factors combined, you can see how we are really pushing women to reach the point of crisis. Now, on our Women's Suicide Prevention Hub, we've partnered with 10 organisations, which are shown there, really taking in the lived experience and expert advice and support to really build our information around supporting women. Next. But it's always vital to share that recovery is possible. The research tells us that actually we can interrupt suicidal thoughts, and we really can help somebody move on to a road of recovery. When I think about my own lived experience when I was growing up and we had domestic abuse in the family and lots of childhood trauma, I was able to reach out and get the support that I needed at the time, and that really helped transform my life going forward. And I feel that in terms of suicide prevention and what we do at Grassroots Suicide Prevention, it is the community, and everybody can learn the skills and the knowledge to help support somebody. Next, Rosie. So when I'm talking about around what's in our Suicide Prevention Hub, you can learn to recognise the signs. So looking about what somebody might be saying and talking. So somebody might say, I can't take this anymore. You can look at their mood and their behaviour. So somebody might actually be really happy and elated, but that's really out of character for that person. You can also learn about asking directly around suicide. There's a real common myth that if you ask around suicide, you might encourage somebody. It's simply not true. The research shows you can interrupt suicidal thoughts. Our information hub also talks about how to set up a conversation, how to have a really safe space, which is non-judgmental, and really take the lead from the person that is needing support. We also have a Stay Alive mobile app, which you can download for free. And it will help you take you through how to have that conversation. It will also enable you to find help and resources in your local area. It also guides you through how to develop a safety plan with that person. And you can really support, and everybody in our community can have the skills to really support somebody. Next. So on our hub, we've got mental health tips for women. We've got the warning signs, how to support somebody, and obviously you can also download our Stay Alive app. Next, Rosie. That's it, thank you. That's everything from me.
Great. Yeah, thank you for giving us that insight and particularly sharing the message that you can interrupt suicide ideation. So that's a key message. Okay, so I think I think I was expecting some myths, but we're moving on, I see, to our next speaker then. So to Wendy Robertson. She also works at Rethink Mental Illness as a service manager, and she's going to talk to us today about suicidal thoughts, particularly in the context of criminal justice and the criminal justice system. Wendy?
Hello, thank you. I just wanted to make reference to the left-hand column that I'm reading, which is our services, the SOS and Mendel service, and we have another contract, the NHS bereavement support. Today we're just going to talk about our Mendel service, and I'll explain what that is. But mainly, Rethink have been in Brighton Hove since 1995, which has evolved, and we support anyone who's been affected by suicide, whether that be thoughts of, attempts or bereavement. And we are part of the large psychosocial network of services in Brighton and Hove with UOK. Next, please. So today we're concentrating on suicide prevention and Mendos, a unique social response. And I want to thank someone personally who this presentation is based upon. And Ben, I know you're watching. Thank you for joining us, and thank you so much for volunteering to speak about your experience of using our service, but more importantly, your experience of what it was like for you relating to having to wait to go to court, and how you managed to make a difference in your life. Next, please. This presentation can't even begin to address all the issues relating to why people in prison and people who've recently left prison are at increased risk of suicide. There is a growing body of research, thankfully, both locally and internationally, that is relating and looking at this. And suicide, and I'll just read it, suicide is always complex and rarely caused by one factor alone. International evidence shows that the increased risk of suicide in prison is due to a unique combination of pre-existing factors and the environment itself. And we know that there is, unstable housing, finances, no one that someone has a connection with, substance misuse. There's a whole host, domestic violence. There's a whole host of reasons why people feel so lonely and feel that they are without hope or a future. Thank you. So I'm introducing Ben. We met last week and we discussed issues pertaining to this presentation. And go on to the next slide, please. So Mendos is our other service. It's called Meaningful Discussions. It's psychosocial support, and we assist those who have current or historic offending history and a mental health diagnosis. And we support in the community both pre and post probation or prison, and we do this by offering information, practical and emotional support, signposting and advocacy. We can go to court and be a support, and whilst they're in court we can meet with the person afterwards, and we like to see people through their journey and give them as much information as possible. And we cannot do this in isolation. We do this with working flexibly with a lot of other services who are also involved in that person's care and treatment. Next, please. So during the discussion with Ben, one comment, so in terms of context, Ben was referred to our service because he was experiencing a lot of anxiety and was contemplating suicide and had come very close. He was being supported by UOK at that time, who suggested a referral to our service. And so I have put this slide on as some of the quotes and discussion with Ben. And basically he recognised he needed longer support and was referred by UOK, and that he felt he'd been brooding and was really isolated, couldn't speak about what was going on for him, and why it had come to that he had been involved with the courts and the police, and that he came close to suicide, and without the support, he said that he didn't know if he'd be here. He felt he didn't see a future, but but the support by Mendos, i.e. being able to see it through, he now reflected that he has a future he can see other than what was going on right now. And part of the support was also Ben feeling like he was accepting responsibility and about his own situation, but not just seeing himself in because of that moment in his life, but that it was trying to draw out all the positives, all the skills, and the as to what makes Ben Ben. And he found that the preparation of what to expect in court really valuable. So we were able to give fact sheets and also have discussions about what to expect when he was in the courtroom, and look at the pre-sentence reports, what they're looking for, also the mitigating factors, etc. And Ben said that was particularly helpful and it reduced some of the anxiety. And more importantly, Mendos was able to offer flexible service. Sometimes services offer a fixed amount of time, but what was really important was that because we didn't initially know the court date, we spaced it out so that we could support Ben throughout the whole process. And Ben really appreciated that, and he said that flexibility really assisted him. Ben reported when I saw him last week that the thoughts have reduced, and he doesn't feel as bad as he did before Mendos, but he is aware that sometimes in the future he might have difficult times or not. But we talked about how Ben could draw upon the supports that he knows about now. Next slide, please. So I asked Ben what his message to others were, and he said very quickly, actually, like, look, whatever's going on for you, reach out, speak to someone, anyone, that they will signpost you to where you need to. It's not easy to reach out, and I think Ben said himself that one of his biggest fears was being judged, but he felt relief when he did find a service or speak to someone, his GP or other people. He now sees a future and he feels his quality of life has improved. He's post-sentence, he realised what he has to do in terms of reporting to probation, but it's not, his life isn't just about that. He knows that this is the start of his future, and he has plans not to get himself in a situation like that again, but also, and that's not like that for everybody, we recognise that, but this is Ben's experience. He importantly felt that this process did save his life, and he was very grateful to be able to be offered the flexibility to use a service such as ours. Next slide, please. So final thoughts regarding suicide prevention. This is for all of us, really. If you see someone struggling, say something, make time. Might not mean a lot to you, but I promise it will mean something and everything to the other person. Suicide is preventable, but it's complex as well. Let's start the conversation to let people know they're not on their own. I think I just want to add the point here that it's very true that some people live with suicidal thoughts throughout their life and may need, there might be a year where they may need lots of support, and there might be times where people around them feel fatigued. But I urge you to just continue to let people know how you're feeling and to get the support you need, and reach out. Don't stop doing that because you think that you're burdening someone. You're not. Please just reach out. The main resources I use just for this short presentation, these aren't the only resources. There's such a lot out there of Rethink. There's and also if you go to the World Health Organization, they've got so much information on prevention of suicide, international figures as well as local. And Samaritans did a very good report on the prisons and suicide in prison report. Thank you very much.
Great, thank you very much, Wendy. Everyone's sticking to time nicely, making my job nice and easy. But yeah, key point there, you know, if you do need the help, reach out. Thanks. And also nice to have some lived experience injected in via Ben's story. So thank you, Ben, for allowing us to include that. So continuing with some lived experience, I'm going to pass to another member of Rethink Mental Illness, and that's Gemma Besant. I believe she's a suicide bereavement worker, and she's got a video to share of an interview, but she's going to tell us a little bit about it before she plays that. So over to you, Gemma.
Thank you everybody. So this next section is about a truly inspirational family and touches on some sensitive topics. I want to say a huge thank you to Vanessa and her family for allowing us to shine a spotlight on her and her family and the support they received. With permission from Vanessa, who's watching today, I'm sharing some background on the challenges she and her family faced. In 2015, Vanessa lost her brother Glenn to a tragic murder. Then in 2023, she unexpectedly lost her stepfather while he was on holiday. Tragically, just 11 weeks later, Vanessa's brother Matthew took his own life. Rethink provided support to several members of Vanessa's family, including her son Lewis, who is autistic and has ADHD. Together, Lewis and I explored the aspects of his life that were causing him difficulties, especially in processing his grief. Lewis was incredibly eager to make positive changes. We worked together to create a plan, which he stuck on the fridge as a reminder, and he began to take steps to turn things around. Here's the video. So welcome, Vanessa, and thank you for your time today. So we just wanted to talk about some of the support that you received from our service. So you and your family experienced multiple losses and traumas before coming to our service, and then obviously losing your brother in 2023 to suicide. So your son Lewis has a diagnosis of ADHD and autism. Could you tell us a little bit about how these events impacted Lewis's behaviour and his overall well-being?
Yeah, Lewis went down a real rocky road. He basically started drinking. He was out of control drinking. Jack Daniels was a lot of the problem. Very impulsive behaviour, fighting, going out, getting arrested. He wouldn't take his medication. He even had suicidal thoughts of his own. He had a massive motorbike accident which caused him life-threatening injuries, and we ended up on 24 hours in A&E. There was just no reasoning with him at all.
And in what way did our service differ from any other support systems that you tried? Was there any particular aspects that stood out for you?
Yeah, with Lewis, he's never liked talking or listening or taking advice off anybody else. But when he come to Rethink and met Gemma, he really totally changed. He listened to him, he listened to her. He stopped the drinking, started focusing better, started taking his medication. Did have a couple of blips, and still are, but nothing like he was. He listened, he aimed, had goals, targets, stuck to them.
Amazing. So in terms of tools and strategies provided, can you tell us about some of the things that we put in place to help Lewis?
Yep. Each week, a new goal and a new aim was set for Lewis. A new focus, so like focusing on different ways of going out, not getting in fights, not getting arrested, not drinking, what different drinks to try, not how to, like, if instead of going out spending all his money at a weekend or in the week, aim at something like going to the gym, which he goes to now. He goes to the gym every night. He does boxing, which is one of his hobbies, off-roading, motorbikes, everything like that. He aims, focuses, and he now actually does. Plus, on a good side, we're taking on medication again.
That sounds amazing. I've got to say that working with Lewis and obviously looking at the whole situation and not just his grief, we identified together lots and lots of different things that were stopping him processing his grief, and he was so receptive to anything that I suggested. He just wanted to make these changes, but it was like he didn't know where to start. So yeah, he was a really special person to work with. He was great. So how did the support provided by our service impact you personally, and were there any significant changes in your own well-being as Lewis's parent? And can you share with us how he's doing?
He's doing really well. As for me, I still have up and down, but it really did help to talk to someone that isn't family, isn't friends, that is not involved in the situation, but understands the situation. And it's nice to know that we can still contact Rethink if we're having bad days and bad times. Lewis is doing really well. He's doing boxing twice a week, and I think he's hoping to have a fight eventually, a professional fight, you know.
Yeah.
He doesn't, when he does go out, he doesn't always drink. He drinks water most of the time, or Red Bull, which is a bit of an energy drink. But he does come home and does sleep. He takes vitamins. He's like a totally different person. He's a bit on a health kick, so he's eating and drinking lots of healthy stuff, lots of steak and greens. He's into his greens at the minute. But yeah, definitely like a totally different boy. Totally. And he does sleep and he's concentrating and listening more.
That's so good to hear. And he's been doing some fundraising, hasn't he?
He has. So yeah, he has. He's been doing half marathons, and he's got another one coming up in a couple of months, I think it is, with other family members. And they're doing a GoFundMe, which is on their Facebook, Sport Rethink, and they do half marathons.
That's so good to hear. Brilliant. Thank you so much for your time, Vanessa, today.
You're welcome.
Thank you. Bye-bye.
Wow. Okay, that sounds like some great work. Again, thank you very much to Vanessa and to Lewis, for allowing us to share part of their story and their journey. And that sounds like great work on everybody's part. That's inspirational. So thank you. So like we said, that has given you a little bit of insight into 3 particular communities that sometimes fall through the net, that being women, ex-offenders, and those suffering from autism. So then to our final presenter speaker of this webinar, Brooke Joyce. She's the partnership lead at UOK Brighton and Hove, and she's going to talk about partnership working in the community approach to suicide prevention. So
hello,
I'll pass over to Brooke.
Thank you very much for your lovely introduction, Richard. So good afternoon, everyone. As Richard said, I'm the partnership lead for UOK Brighton.
Oh, I think you might have gone on mute.
Oh,
Brooke,
sorry. I'll start again.
There we go.
Good afternoon, everyone. So I'm Brooke. I'm the partnership lead for UOK Brighton Hove, and I work for Southdown, who are our lead provider. There have been some really inspirational speakers today, and I feel extremely honoured to follow them, to speak to you all about partnership working and a community approach to suicide prevention, which is a subject close to my heart and at the centre of my role. As we know, not one organisation can address the complex issue of suicide prevention alone, and this is where the power of partnership truly comes in, because suicide prevention is everyone's responsibility. So all of these lovely colourful logos here are UOK Brighton Hove and UOK Sussex Partner Services. And I'm very fortunate to lead our partnership of 18 incredible community services in Brighton Hove called VCSE, Voluntary Community and Social Enterprises, often referred to. We also work together to provide non-clinical, accessible support for different types and level of need. And we're the first network of its kind in the city and have built our connections and pathways to support since our inception in 2019. We have a central access point and people can contact us to find out more about the right service for them. And we don't just work together, we also work collaboratively with the organisations at the bottom in our community and our commissioners, NHS Sussex and Brighton Hove City Council, and our partners at Sussex Partnership Foundation Trust to deliver services. So what is the number one most effective tool in suicide prevention? Well, it's people. It's community and working with each other to share information and prevent those who need us from falling through the cracks. If we then throw partnerships into the mix, think what we can achieve together. Sharing information about services, suicide prevention training, resources and stories, so much more. I'm aware that organisations in Brighton Hove are excellent at partnership working, so I'm really not telling you something you don't know. I moved here from London 2 years ago, and I can honestly say I've been blown away by all of the connections and passionate people I've met, most of all on this call. And I just want to make, and they just really want to make a difference. So we can all make a difference. And I truly believe that partnership working, it really is the key to achieving even more. So when I say partnership working, I mean creating strong collaborative relationships where each individual or service contributes their own unique expertise. And as we've heard from today's speakers, the VCSE sector tends to pick up challenging and complex cases and individuals. While healthcare providers offer clinical support and crisis intervention, community organisations like UOK Services can provide essential outreach, education and emotional support. One without the other just simply doesn't work. We need each other. So most of the people on this call will have heard of the community mental health transformation, where we will see neighbourhood mental health teams rolled out across Sussex and in other areas of the UK. So these teams will include primary and secondary care, local organisations, services and providers who will come together to provide joined-up care for our communities. Suicide prevention will be at the heart of the transformation as we work together to improve access to services and ensure that people find the right support at the right time. There's more information about the community mental health transformation on the resources section that we can share at the end of the webinar. We've got a snazzy QR code for you. So how can partnership working help prevent suicide? And the first one is improved access to services. So partnerships between healthcare providers, mental health services and community organisations that will happen through the neighbourhood mental health teams and the partnerships you all create can ensure that people have access to the support they need. This coordinated approach can identify and help those most at risk. We can have open conversations. So working in partnership and building relationships can help to open up honest conversations, start the conversation about suicide prevention, talk, socialise and ask others what they're doing. Once you get going, perhaps you can suggest ways to work together to achieve more. Sharing. So sharing experience, best practices, resources and tools can help to educate our communities about mental health and the warning signs of suicide. By spreading awareness, we can bring people the knowledge to recognise when someone might be struggling and how to offer support. This doesn't need to be anything expensive. You can reshare other posts on social media, write a blog to be featured on your intranet, or write an article for your local paper. Or you could organise a webinar like we have today, and it's been completely seamless and easy, I promise. But you just simply need to spread the word. So shared training programmes are also really important to educate and understand how we and the people around us can make an impact. The UOK partnership is extremely fortunate to have Grassroots Suicide Prevention fantastic training suite, including mental health awareness and mental health first aider training, and this training is shared with the partnership. Last but not least, reducing stigma. As we all know, stigma around mental health can prevent people from finding the help they need. By challenging misconceptions and talking, we can create a more accepting environment where people feel safe to seek help. So a community approach to suicide prevention is about making prevention the golden thread that runs through all of our work around mental health. It means building an environment where mental health is openly discussed, free of stigma, and help is accessible. And I know I've mentioned partnerships more times than you probably looked out the window today and wished it was the weekend, but it's not just about the power of partnerships. So I also got sold in sales training many years ago that it's all about the power of three. So I will leave you today with 3 simple calls to action. So improve access. Use partnerships to ensure access to the right support at the right time. If you work for an organisation that supports people, question whether people who might need you know about your organisation and what you do. Also question whether they would access you directly. Maybe they would trust being referred by a partner organisation they're already connected with. I've been dropping into team meetings and presenting UOK recently, which has built strong connections and allows people to refer clients to us if they need to, and just simply building those good relationships. Share and educate. So share resources and reduce stigma through education and shared training. Is there perhaps a training exchange you could do with another organisation? Your staff goes to theirs and they come to yours. Encourage conversations. So have open conversations about mental health and suicide and collaborate to ensure the most amount of impact for our community. So please build strong partnerships and engage with your community. No one organisation can address suicide prevention alone, because suicide prevention is everyone's responsibility. This is a little bit of a plug for our service, so please do get in touch with UOK if you or someone needs support. We're here 9 to 5, Monday to Friday, excluding bank holidays. You can call us on this number, visit our website. That's actually just had a bit of a rejig, so we'd really, really appreciate if you visited. Or you can email chat@uok.org.uk. And a shameless plug of our socials here, but please do follow us. Thank you.
Great.
And Richard, I believe
Thank you very
I'll hand
much,
it to you.
Brooke. Yes, thank you very much, Brooke. Once again, thank you for keeping nicely to time, making my job nice and easy. So look, just a few minutes to round off. So first thing I want to do is just thank each of our speakers who have represented the 3 organisations that have put this together. And despite Brooke saying it's seamless, that these things only come together because a lot of hard work goes into them, which I've been privy to a little bit of as the chair, but not a lot of it. So thank you very much for organising it, and that goes to Rethink, mental health, mental illness, sorry, with suicide prevention, and also UOK and South Down. Look, I mean, it's really hard to sum up, so I probably wouldn't attempt to, but maybe I'll just share a couple of things that stuck in my mind. So one theme obviously about working together. People, as Brooke said, are the key. We were reminded, I think, by Wendy, that you can interrupt suicidal ideation, suicidal thoughts. So that's a key thing. People are key to come together in community, reach out, start the conversation, which is what this is about. Continue the conversation if you've already started it. Also, from Lord's reminded us that it's key in designing, initiatives to deal with suicide prevention, to include those that have lived experience. I think that's a key thing. I thought Rachel also made a point that stuck with me, and a key point that we've talked a lot about suicide and mental health, but it's not just mental health. Particularly, if you remember the slide that she put up in relation to women, there's a number of other issues that can play a part in it. And again, the times we're living in, economically very hard for a lot of people, that also plays a part. So let's keep that in mind. And then just to not only thank the speakers, but also those that were represented, Ben, Vanessa, and Lewis, for sharing stories that show that actually, as hard as life gets, you can actually push through and transform in the way that it seems Lewis has. So that serves as an inspiration for us all, and gives us the hope to continue and to keep pushing on with the work that all of these organizations are doing, and that I'm sure a lot of you are doing who have taken part today. So look, I just want to say thank you again for joining. We'll share the slides, the resources, and the recording. these organizations are here. Like Brooke said, it's not a shameless plug. If you need help, reach out to UOK or other organizations here, or use one of the numbers that I think have been shared in the chat. And then to any questions that were asked in the chat, like I said at the beginning, we will respond to all of those. So we will send all of the questions and our responses to all of those questions to everybody that has attended today. Yeah, so thank you. Like we said, start the conversation if you haven't already. Continue the conversation if you're already doing good work. And let's try and get these rates, down, because each life saved is, is a move in the right direction. So thank you everyone for taking part, whether you presented, shared the story, or attended, or will go and tell others about it so that they can watch the recording. So